Excellencies, distinguished guests, good morning, afternoon, or evening, depending on your respective time zones. It is a privilege, an honor, and a pleasure to welcome you to this webinar entitled COVID-19 Lessons Learned and Mapping the Way Forward, co-organized by the co-chairs of the UN Steering Committee on Partnerships for SIDS, in collaboration with the UN Department of Economic and Social Affairs and the UN Office of the High Representative for the Least Developed Countries, Landlocked Developing Countries, and Small Island Developing States. My name is Patrick Mifsud, and along with colleagues from the Small States Center of Excellence, I will be moderating this first segment. For the smooth running of this online event, may I kindly request all participants to keep their microphones muted and to unmute themselves only when given the floor. Without further ado, I would like to invite Her Excellency Vanessa Fraser, Permanent Representative of Malta, to make her opening comments. Ambassador Fraser, the floor is yours.
Thank you very much. Thank you, Patrick. I would like to say actually welcome to Malta to everybody else, because I too am in Malta at the moment. I'm very happy. Finally, after 14 days of quarantine, I'm able to go out and have some meetings and enjoy this beautiful country before I return to post. So it's really a great pleasure for me to address you today as a co-chair of the SIDS Steering Committee. The first in a webinar that we are planning for the course of our chairmanship. During this first webinar, we started with the most topical question that everybody's discussing at the moment, the single matter that has taken over our lives since the beginning of the year and has changed our lives for months on end and has transformed the way we work, the way we think, and the way we live. And will continue to do so. So, of course, as always happens, the degree and extent of the health pandemic has not been uniform. The local realities may be different, but nevertheless, what is certain is that in today's interconnected and globalized world, we have and still are facing a common threat to our societies, to our economies, to our present, and to our future. Health systems have, of course, borne the brunt of the pandemic, with ever-increasing demands in ever-changing circumstances, requiring more and more resources, in particular human, technical, logistical, and medical, at a time when, due to border closures, supply chain restrictions, travel restrictions, and social distancing, reserves and remittances needed to serve these demands were obliterated practically overnight, or at best, greatly undermined. I am convinced that today's discussion will serve as a valuable opportunity to look at what lessons have been and are being learned about this pandemic, and possibly allow us to map the way forward to increase resilience and preparedness. Given the very real possibilities of subsequent waves, we are already starting to see, as we know, hints of second waves or other pandemics that might be similar to this for that matter, which we may face in the future. We need to ensure the idea behind, before I close, and I will talk off the cuff now, the idea that we had behind this webinar was that we would like to come up with a set of lessons learned, which will be a tangible list to help us when we have to face future pandemics, because clearly this is the first of a new series of threats that we are facing. It is not an isolated, it is just really the new world that we are living in. And so the idea is to learn as much as we can from this so that our small island states will be able to react as quickly as possible in the future. So thank you very much. Thank you, Patrick, for moderating, and thank you in advance to everybody else who is participating. I'm very pleased to see the level of participation that we have, and especially I'm glad to have Gabriella Cassola again with us here today from the Commonwealth Small Island Institute that we hosted in Malta, and which at the very first meeting that I co-chaired, I did mention that we would like to use and would like to create synergies between this institution which we host in Malta and the UN SIDS pathway. Thank you very much. And I pass it on to you, sorry. Are you hearing? Can you hear? Well, I can't hear everyone.
Okay, yes, sorry,
Okay.
I was muted. All right.
Okay.
Thank you, Ambassador, for your opening remarks. I now invite the distinguished representative of the UN Department of Economic and Social Affairs to deliver his remarks. Thank you.
Thank you, Patrick. Co-chairs, Ambassador Fraser, Ambassador Watson, my colleague Fikita, US Chair for OHRLS. Excellencies, panelists, ladies and gentlemen, I'm honored to join you at this meeting. Today's discussion is the first in a series of global SEAS partnerships within us, organized under the auspices of the SEAS framework, partnership framework. It is an integral part of the UN Steering Committee on SEAS partnerships approved work program for 2020. I commend the co-chairs for their choice of topic and efforts in organizing this event. It provides a practical platform to exchange experiences, best practices, and lessons learned, thus encouraging formation of new, genuine, and durable partnerships for SEAS. Excellencies, as we speak, COVID-19 pandemic continues to rage, unaffected by seasonal trends, sparing no region, and threatening to inflict the worst recession since the Great Depression in the 1930s. This public health and economic crisis has exposed vulnerabilities and inequalities within and among countries. Prior to COVID-19, SEAS were already confronting unique challenges in preventing, detecting, and responding to infectious diseases. With the average global health security index score of 28.9 out of 100, SEAS health security capabilities are well below the global average of 40.2%. They generally lack healthcare infrastructure and technologies. Their health workforce is limited. Public health spending as a percentage of overall government expenditure is typically low. High prevalence of pre-existing health conditions, such as diabetes, cardiovascular disease, and obesity, make populations in SEAS particularly vulnerable to COVID-19. Most SEAS do not have COVID-19 testing or advanced facilities to care for severe cases needing specialized treatment. The latest statistics from WHO reveals that health impact of COVID-19 in SEAS ranges from relatively severe in the Atlantic and Indian Ocean to mostly contained outbreaks in the Caribbean to almost virus-free in the Pacific. Swift actions by many SEAS governments in limiting cross-border movement and imposing strict social distancing measures must be commended, as it has gained some positive results in containing the spread of virus. But at the same time, we have to realize that these containment measures really has the devastating impacts on the economic and social impact of the SEAS economies. Excellencies, COVID-19 exposed inadequacies in health systems worldwide. As countries plan for recovery, attention should not only be strengthening of a health system at the national level, but also at the global level through investing in global public goods for health. International solidarity and multilateral support are critical for forging a stronger global health system and building resilience against future epidemics, pandemics, and other public health challenges. Excellencies, only through a concerted effort as a united global community can the world overcome COVID-19 and pave the way for a healthy, more sustainable future. Strengthening long-standing multilateral cooperation with and supporting seas in addressing their vulnerabilities and sustainable development efforts has never been more critical than in any other juncture in our recent history. I look forward to this discussion and to hear your views on how we can together map our way forward. I wish you have a very pleasant meeting and a very fruitful discussion. Thank you.
Thank you very much for these opening comments. It is now the turn of the distinguished representatives of the UN Office of the High Representative for the Least Developed Countries, Landlocked Developing Countries, and Small Island Development States to take the floor. The floor is yours.
Thank you, Patrick. Your Excellencies, Ambassador Vanessa Fraser, Permanent Representative of Malta, Ambassador Aubrey Webson, Permanent Representative of Antigua and Barbuda, and co-chairs to the SIDS Partnership Steering Committee, my colleague, Mr. Liu Zemin, Under-Secretary General of DESA, Excellencies, colleagues, ladies and gentlemen. I join my colleagues in welcoming you all to our webinar. A big thank you must go to the co-chairs as well as the Small States Center of Excellence for organizing this timely webinar. If I had addressed you last year, I would have said, here we are, the glass is half full. Many complex issues remain, but the SIDS are making every effort to realize the SDGs, the Samoa pathway, and meet the goals of the Paris Climate Agreement. Here we are in 2020, a year that certainly none of us will ever forget, and the COVID-19 pandemic now threatens the lives and the livelihoods of the SIDS citizens. Of course, the immediate issue is one of health, but as we all know, the health status of people is linked to a complex set of socio-economic issues. So I really look forward to learning today from our partners, our speakers and panelists. As I said, the immediate issue concerns the health impacts of the virus. To date, they have been severe in some SIDS and thankfully not yet in others. So far, several Pacific SIDS have avoided outbreaks. My thoughts and condolences go to families and friends of all those whose lives could not be saved. What we see, and this is a serious concern, is that across the board, people in nearly all SIDS experience reduced food security, increased malnutrition, or vulnerable children receive less care outside their homes. Education systems are disrupted. Like elsewhere, violence against women has drastically increased. Women who disproportionately work in the health sector are not only the most exposed, but do double shifts between work and family. Gender disparities in the impact of COVID-19 crisis are evident, and we need to take that into account. The pandemic has not only laid bare already existing challenges, but has also laid bare what high degrees of inequality means in a pandemic, and has now driven the situation where potentially we talk a glass half empty rather than half full. And the pandemic, while a major aspect of the challenges SIDS face, is not standing on its own, as the many risks include those to health from climate change, natural disasters, and external economic shocks are all part of this near perfect storm that SIDS now face. Given border closures, disrupted supply chains, globally rapid dropping consumption, highly reduced remittances, near to non-existent tourism, which is a major employer and earner in the SIDS, many already have lost jobs. We must also be able to be concerned by the state of the economies. The state of the economies means the state of household budgets and their capacities to afford food, healthcare, and basic necessities. It is clear that sustained international support is needed to ensure we do not leave the SIDS behind, and I add, it is needed now. The Alliance of Small Island States has made strong calls for major fiscal measures to enable SIDS to cope with the crisis and to preserve hard-won development gains. The reality, sad reality, is that so far this year, an increase in international support has not yet materialized. Take humanitarian relief. This year, it is a third lower than the same time last year. From a global perspective, the UN estimates for an adequate humanitarian response stood at 40 billion. So far, only 1.7 billion has been pledged. The question before us is simple. Do we want to leave the SIDS behind, or do we want that the people of the SIDS are included in the sustainable development path that the Agenda 2030 wants to achieve for all? Now is the time to be proactive. Now is the time to further partnerships between SIDS and with their partner states and the global community. In the short term, of course, focus has to be on the immediate and urgent healthcare responses. But for the responses to be sustainable, now is the time to invest in and build capacities for and with the SIDS to manage forward through the range of complex issues, all having ultimately a bearing on the health status of their people. In closing, I reiterate the commitment of OHRLS to continue to strongly support the SIDS Partnership Steering Committee. I thank all the participants for your contributions and look forward to listening to you. Thank you.
Thank you very much for these comments. This brings us to the end of our first opening segment. It is with pleasure that I now pass the floor to Gabriella Cassola, Deputy Director of the Small States Center of Excellence, who shall be moderating the next segments of today's event. Gabriella, over to you.
Excellencies, distinguished guests, greetings from Valletta. Excellencies, distinguished guests. Good afternoon from Valletta. My name is Gabriella Cassola and I am the Acting Director for the Small States Center of Excellence, which is based in Malta. The Center of Excellence for Small States is, as we like to describe it, a center that breeds small states. It is a center by a small state for small states. Islands, as we know, have been considered by many as an idyllic paradise for many seeking to escape. Obviously, with the onset of COVID, and thankfully some islands have managed to stay COVID-free, that is a very good choice. But of course, once COVID hits islands, then that is where obviously we have a whole new series of problems. In order to help us understand and for us to gain a better picture, we have asked the National Statistics Office of Malta to help us decipher the statistics and to set the ball rolling for our debate. Alan, the floor is yours.
Thank you, Gabriella. I'm trying to share my screen. Okay. You're seeing the presentation, Gabriella? It's fine? Good. All right.
Yes, we are, Alan.
All right, thank you. We were asked to provide some data on the impact of COVID-19 to set the scene for the subsequent panel discussion. But just to sort of a disclaimer, the NSO is not in the business of collecting worldwide data. But we do work with partners that do precisely that. This is, they collect and produce timely and reliable statistics and projections that allow us for comparability between states. So the statistics presented in these infographics have been adapted from the data collected by international organizations, in particular the World Health Organization, the IMF, and the World Bank. So at the most basic level, the first thing that one looks at is the number of COVID-19 cases. So with the worst case scenario being that, this map visualizes exactly this, the deaths due to COVID-19 data, and lastly updated on the 21st July. So the dark dots, I hope, no, okay. So the dark dots here show the countries that had more than 80 deaths. 80, 100, and even thousands of deaths. So as you can see, numerous countries fall within this range. So the further up we go here on this scale, and yellowish dots pop up, those indicate the countries that had less COVID-related deaths. So if we see how these yellow dots are scattered, they mostly represent small island states. Yeah. So therefore, the basic data shows that the least impacted were SIDS, but that wouldn't really be correct. So even at the most basic level on the impact of COVID-19, we would have to look at the population size. So the number of deaths in SIDS makes sense when one compares them to the size of the state's population, of the small state's population. So when we compare SIDS with other regions, both based on geography and also on the level of development, it is evident that SIDS have the smallest population from these regions, has the smallest, the red one is SIDS, it has the smallest number of confirmed cases. It has the second smallest number of deaths, preceded only by sub-Saharan Africa, and the smallest number of active cases. But, okay. Okay, so, but when one begins to calculate ratios and percentages, a different picture emerges. So taking the ratio, SIDS has the second largest ratio of confirmed cases. This is SIDS. The second largest ratio of deaths, only after Western Asia, and the largest ratio of active cases. So the impact of COVID-19 must be measured also from its indirect effects. I mean, they say no man is an island, but in this case, due to the mechanisms of the international economy, which is fueled by globalization, we can paraphrase this as no island is an island. I mean, not in a geographical sense, but meaning that we are all clogs in the mechanisms of the international economy. And due to globalization, an effect in one part of the world is felt in all others. So, and COVID-19 did indeed prove that everything is connected. It affected the international economy by, for instance, disrupting transport and mobility and disrupting international trade and the labor market. So this had an effect on all states, affecting in particular, and most particularly to SIDS and tourism in general, which includes employment in the touristic industry and the government revenue from the tourism sector and all other sectors that cater for tourism. Now, this leads to an issue with the servicing of debts, so less revenue, more burden on debts. Food security, much food is imported for small island development states. Sustainable livelihoods because of lack of unemployment, a halt in remittances coming from abroad, which affects, again, sustainable livelihoods, and ultimately the provision of inadequate healthcare services. Now, coming to healthcare, given that it is the topic of today's webinar, COVID-19 is not the problem. It's a problem added to several other existing problems. So if we have to take health in general, but more specifically that related to non-communicable diseases, statistics show that NCD-related deaths in SIDS amount to nearly 72% of all deaths. Now that's in line with the global average, but if we compare them by region, is much higher than, for instance, the least developed countries, which is 40.6%, and with the sub-Saharan Africa, which is 41.2%. So, I mean, treating NCDs is expensive. So it represents a high cost to society and also a growing burden to the government finances. So both directly due to the costs, to the incurred costs on the health system, but also since most people dying from NCDs are within the employable age range, which affects its supply to the labor market. So this graph here, this one, it shows the domestic general government health expenditure as a percentage of the GDP, and it starts from 2000 and it ends at 2017. So as you can see, there were fluctuations, but by 2017, the expenditure as a percentage of the GDP in SIDS was less than the world's average. Again, the second graph shows the domestic general government health expenditure as a percentage of the general government expenditure. And this also shows that the expenditure on health is also lower than the world average, with the exception of small states in the Caribbean. So the green line here shows the global average, and this shows in tandem with the global average, the ratio, the percentage of Caribbean states, the IAS states, and the Pacific states. So injection of further government funds into the healthcare system is not that easy. For instance, the IMF projects a fall in the GDP of SIDS by nearly 4%, the yellow line here. So therefore, to bring it all together, the healthcare system in SIDS here, which is affected by COVID, and taken into consideration that the fall in GDP in SIDS is the steepest and lowest compared with other regions. So bringing all this together, the healthcare system in SIDS is already burdened by existing conditions. And adding all the impacts of COVID-19 on the health of SIDS population and also on government revenue will further exacerbate the vulnerability of SIDS. So from me, that's all. And I hope that this is sufficient information to set the scene for the next discussion. Thank you. Gabriella, all yours.
Thank you, Alan, for that extremely interesting information, a lot of information and a lot of interesting facts that emerged from your findings. May I remind all participants that there is a Q&A possibility. All the panelists will bar for Professor Calleja, our next speaker, will be with us till the end. And even should the panelists no longer be with us, we'll be able to relay that question later on to them too. We will now pass on to our much awaited panel debate. May I, as we already mentioned, we have a Q&A function. We will be taking Q&As at 2 intervals. After the intervention by His Excellency José Luis Rocha, and after Mr. Medeb's intervention at the end of the panel debate. Our first panelist is Professor Neville Calleja, Director of Public Health Policy at the Ministry for Health in Malta. Professor Calleja, the floor is yours.
Hi, thanks, Ms. Cassola. Not sure. I have a few slides prepared by Professor Gauci. So first of all, thanks for the opportunity. I'm replacing Professor Gauci a bit at short notice because she was called in for an urgent meeting, but we've been working together anyway throughout the COVID epidemic. So let's say it didn't take me much time to pick up on the slides she prepared. So if we may maybe go to the next slide. Mr. Mifsud? Okay.
We have, yes, we are on the first slide, Professor Calleja.
Yes, this is the title slide. So anyway, yes, thank you. So basically, if I can relate a bit to our experience here in Malta and trying to take it in the context of small island states, I think wherever you are, whether a small island developing or not developing, or a large state, I think the two pivotal tools that public health has to address the spread of infection. The first one is what we call the treaties, to test, to track, and to trace. So the idea is to try and identify as many cases as possible so that you can isolate those cases and contain the spread. So we know from the massive amount of literature that has been generated over the past few months that the natural growth of this infection is around about 2.5 infections per participant. Sorry, I'm just saying the question. Per patient, per infected patient. Needless to say, so the way to actually contain that and slow that down is to try and isolate as many of these infected persons as possible. Now, knowing that asymptomatic persons can actually spread, and this, I understand, was a topic of debate a couple of months ago, maybe, when there was a bit of a discussion also within WHO whether there is spread from asymptomatic persons or not. I think the consensus now is that asymptomatic persons do spread the infection, even though they are less infective than a symptomatic one. So given the sheer volume of asymptomatic persons, which is usually estimated to be around about 4:1, 4 asymptomatic persons is to 1 symptomatic person, the sheer volume of asymptomatic persons socially active going about in their daily lives are obviously quite a threat. So clearly, only those countries who have actually tried to invest in testing have actually done well in containing the spread. Malta has been trying to do that throughout the pandemic. Other countries have accelerated their testing when there were outbreaks. Next slide, please. So, next slide. The next pillar clearly is mitigation measures. Again, it's all about reducing spread, or the very famous now reproduction number, or RT. Again, we have a bit of a discussion locally right now on what is the RT. RT can only be modeled, really, so there's no hard gospel truth of what is RT. You can only model it and estimate it. But beyond that discussion, mitigation, basically it centers around not many measures, really. Okay, so we're talking here about social distancing, hand hygiene, and use of masks. Okay, consequential to that is the avoidance of physical contact. These need to be mandated, unfortunately. Now, I know this, I mean, we've been trying locally to try and push the idea, listen, to actually follow these rules is to be respectful to the rest of society. It works with some, it doesn't work with others. And especially if we're talking developing states here, it might be that the temptation, so to say, or rather the needs to be as socially active as you were before, simply to make sure to earn an income, is obviously much higher than in developed countries. So the whole idea was to try and prevent this infectious disease from growing exponentially, because then most of the time your hospitals would overflow. When in our projections, basically, that's the assumption with it. If you don't get a bed in an ICU, you're effectively dead. because that's what we've observed also in some of the European neighbors. So this is something that for island states is very scary. Most of us as small countries have centralized facilities, single hospitals, 2 hospitals, very few in any case. And it's very easy to get those hospitals overwhelmed, as opposed to a larger country that could shift healthcare from one affected region into another. Next slide, please. Okay, so as small countries, especially islands, one major challenge definitely for us has been supplies. Supplies pretty much of anything. The typical, I mean, as small island countries, we do not typically have production in-house in the country, or at least we don't have enough production to cover the needs of the population, so we rely a lot on importation. Our typical allies, our typical suppliers were closing the doors on us. I guess one could say it was only fair because they were protecting their own people, but this put us in a very, very awkward position. To complicate matters, the speed with which research was happening was actually identifying, I don't know, candidate drugs that could work, and within a week, you don't actually manage to find supplies of that drug on the international market. So it was very complicated, and this is something that is definitely a threat for any small island state. Needless to say, we also need to support scientific research. In many small countries, research budgets tend to be quite small. Because obviously if there's any money trickling into the health budget, it usually goes to the clinical interface first and then research later. But we clearly need research, not just in vaccines and treatments, we also need research into how our people are viewing, say, the prospect of vaccination. It's useless to have a vaccine if we have an anti-vax infodemic, which is spreading across the world. Next slide, please. Public health-driven economy. We've had, obviously, like many other countries, big and small, we've had a lot of discussion on this, lots of struggles, tug of wars. Many people see health and economy and the COVID world as 2 opposing poles. In reality, the only way forward is actually to go for a public health-driven economy. Economy cannot take risks that, it doesn't take public health measures on board and then risk having to go into 2nd, 3rd, or 4th lockdowns. One lockdown, most small countries, maybe they can shoulder, but very few small countries, developed or developing, can actually take the brunt of a 2nd or 3rd lockdown. The only way to avoid this is to have some sort of lower level but continuous economy. And that can only be achieved by marrying the economy with public health, economy being driven and advised by public health. It's not something we've seen in our living history, and I guess most governments were not prepared to take this approach. Most governments now are very much economy driven. It's, I guess it was a natural progression. So pushing public health when for many years public health has been, I guess, being pushed back slowly was not easy. Next slide, please.
Professor Calleja, just to, we've got about 2-3 minutes left.
Sure, I'll rush through the rest.
In terms of that.
So yes, international scenario, I think I'd already mentioned a bit on this. We also depend a lot on how other countries approach the problem, especially now that travel has started, for example, in the European region. The European Union insists that the situation within internal borders of the EU is similar. We beg to differ because we see differences between the EU countries. And this brings me to the next slide. We definitely need the input of international organizations in helping us achieve this harmonized approach in measures, in measurement, etc., etc. And we also need to achieve more communication between countries. I think during this pandemic, we definitely have increased a lot the expertise shared between countries. Next slide, please. Okay, so I guess I'll just take this slide and then I'll stop. The current challenges we're facing are effectively a number of operators in the economic operators are trying to race to pick up as much as possible. Now they're seeing a lull in the pandemic, or they have been seeing a lull in the pandemic. It's summer, it's a hot country, people would like to take their holidays, even though admittedly many Maltese are opting for staycations or basically seeking local entertainment. Basically, unfortunately, having done well the first time round is giving rise to complacency. And people are thinking that they can take bigger risks. So this is also, we've basically ended up victims of our own success, that some economic operators are feeling that, most people don't say, we did well because public health was really working hard. No, many people just say, no, this infection was, a weak infection, so let's just take risks. Anyway, I'll conclude with that. Thanks, Ms. Cassola. You're still muted, I'm afraid.
Yes, indeed. Thank you, Professor Calleja. So I'm glad that you actually picked up on collaborations and partnerships, because I am sure that this is going to be a recurring theme and it will be picked up on by other speakers. We will now move on to the distinguished representative from Cabo Verde, who represents his country at the United Nations in New York. Excellency, the floor is yours.
Thank you, Mrs. Cassola. You let me know when I will have only 2 or 3 minutes that will guide me. Greetings from New York on behalf of Cabo Verde, all protocol observed. Thank you for having me in this webinar. I would like to walk you on the containing and combating the pandemic, the multiple impacts and response, the way forward, and the lesson learned from the perspective of Cabo Verde. First of all, Cabo Verde is an archipelago with a resident population of 500,000, a diaspora almost twice as large, mostly in Europe, United States, and in continental Africa. It's a large ocean state. The 10 inhabited islands takes a place on a 250,000 square, let's say 250,000 times larger than the landmass. Cape Verde is located 600 miles off the west coast of Africa, and it is exposed to the permanent east wind, which is dry, and the main cause from a recurrent drought that always plagued the islands. Cape Verde has a structural condition and vulnerabilities of a small island developing states belonging to the ACE region. Against this background, Cabo Verde, since independence, has shown determination to move forward. The country achieved most of the MDGs in 2000, graduated to middle-income country in 2008, is engaged in pursuing the SDGs and in an ambition to 2030, and the economy was growing at the average of 6% when the pandemic COVID hit. The authorities reacted resolutely at a very early stage. A national coordination platform for response and recovery was established with the key ministries, civil society, private sector, and international partners led by the United Nations. A set of containing measures were taken, from quarantine, closure of international borders, closing of non-essential services, and public and private schools. Police force worked in line with the health professionals in order to ensure compliance with the directives and also public tranquility and social peace. The human rights were observed, but the population understood some limitations regarding to freedom of movement and leisure. We are going to have local elections this year, presidential and parliamentary election next year. This will be impacted, both campaign and elections, by the COVID. But the government is keeping monitoring the situation. We introduced technological innovation. We have a platform, Com Vida, meaning in Portuguese, meaning with life, that monitors in a daily basis and covering all the islands, cities, municipalities, and regions with statistics regarding the evolution. And as of today, Cape Verde is facing 2,400 positive cases with 22 deaths. The impact of the pandemic reached relevant proportions in all spheres of society, giving rise to target response. Of course, health and nutrition in the front line. Our major concern is the pressure posed to the health system by the COVID regarding the non-communicable disease, regarding the chronic disease, regarding people with disabilities that were at risk to attend the medical service. The food supply was disrupted by not only by the situation, but also by the production that was decreased because we are living 3 consecutive years in drought. It has an impact on food security, water supply, nutrition, and livelihood. The medical supplies was also affected. We increased our capacity for tests. We conduct so far today 40,000 tests, quick tests. We are conducting these tests, giving a priority to different areas and populations. And of course, we have to face the environmental impact in order to recycle more medical waste coming from this situation. The impact was in the field of education to conduct distance learning by radio, teleschool, and printed material. The school feeding program was maintained in order to assure a certain level of nutrition to school. Of course, we have the economic impact because the crisis led to the shutdown of those sectors at the driver's seat for income, employment, public finance, national and international investment, and local value chains. We know the impact in the tourism, transportation, investment, remittance. Tourism represents 25% of our GDP. We know the impact in the employment, 20% in generals, 52% of them are women, and 60% of jobs in the informal sector are also concerned. In brief, the pandemic ended the positive dynamics experienced in the last few years of fiscal consolidation, declining public debt, and poverty reduction. The crisis will produce a substantial increase in poverty, deepen vulnerabilities, and reinforce inequalities. The significant health problems of COVID and non-COVID will limit the access of most vulnerable to their health, rights, and services, which in turn will lead to an increase of poverty and multi-dimensional inequalities. We have different response of a macroeconomic stimulus package, social protection measures, job conservation measures. The way forward is to integrate all these measures in a short term for response, a medium term for recovery, and a long term a plan for building better with different pillars. The most important, of course, is health, social protection, promotion of the economy, macroeconomic measures, and policy coherence. Let me conclude by some lessons learned. I will stop there. First, we believe that the world must and should be better informed and better prepared to face the pandemic like COVID. The reality that the world was not prepared regarding the teachings of the past. Second lesson, the pandemic is an extreme event of global nature that affects everyone that does not respect borders and that requires global and coordinated response, only possible through international cooperation. Third, the urgency of a vaccine raised no doubt, but even more so the need for inclusive distribution as an essential public good. Third, developing countries have a higher exposure to the consequences of the pandemic like COVID due to their unfit health infrastructure and their limited fiscal space to provide quick response. Fifth, I have only 9, but very quick. Fifth, states like Cabo Verde face even greatest impact and difficulties since COVID-19 added to their specificities and vulnerabilities, including, as pointed out by DESA, their small economic base, high degree of openness, and extreme dependence of the economic performance of, from some developed countries. We still face, during this pandemic situation and for emergency support, the criteria of per capita, which is not adapted. We are not taking a weighted multi-dimensional vulnerability index to assist states even in the pandemic situation. Extreme events such as COVID should encourage greater access to ODA, concessional financing, debt relief, and other measures. In Cabo Verde, we noticed that governance was a key player. Leadership, coordination, and function of the institution facilitated the taking of measures in time and the implementation of the response. The government welcomed United Nations system support and its role in leading the coordination of bilateral and multilateral partners. Finally, mobilization remains critical even in this condition of COVID and beyond, to overcome the funding gap of the National Response and Recovery Plan, and also to engage in a sustainable financing for the building back better. Traditional measures of fiscal stimulus and debt relief will be necessary, but they are not enough to avoid the worst possible scenario. I thank you very much. Most of other information will be in my written document. Thank you for your attention.
Thank you, Excellency. Since we are running slightly behind time, what we will do is we will take on all the questions at the end of the four interventions and tackle them there and then. So without further ado, we shall now move on to Ms. Lida Namer. She is a World Health Organization consultant on healthy settings with expertise on public health and organizational health. She's currently based in Italy, which I believe shall be the context of her presentation. Lida, the floor is yours.
Thank you very much, Gabriella. I'm going to share my screen. Can everybody see this?
Yes, we can.
Okay, great. So good morning, good afternoon, and good evening to everybody. My name is Lida Namer. I'm a public health specialist working as a consultant with the WHO European Office for Health and Development based in Venice, Italy. I work with 2 WHO Europe networks, the Small Countries Initiative, which serves countries with a population of under 2 million, and the Regions for Health Network, which works with over 30 European regions. So the lessons learned that I'm sharing today are derived from the support the WHO office in Venice provided to Italy's regions during the COVID emergency, and it reflects information up to the 30th of April. I wanted to make a point of explaining that I'm speaking on behalf of the WHO. So what I present today is an account of what happened in the first phase of the response from a WHO perspective, though. Our aim when we've been doing some documenting has been to extract lessons learned that could help other countries going through the similar situation. And it is definitely not an evaluation of Italy's response or nor of what was placed before the epidemic arrived in Italy. Any background information provided on that is just that, background. So without further ado, you may be asking, why Italy? Italy is not a small island developing state. Well, you're right. It's not. But while Italy is not a small country nor a small island developing state, it was the first country in the WHO European region to face COVID-19 large scale, and it was the most affected for many months. The first cases of COVID-19 in Italy were reported on 30th of January 2020, when 2 Chinese tourists in Rome were identified with symptoms, and they were hospitalized on the same day. Thereafter, soon after, the virus spread exponentially throughout the north of the country. On the 22nd of February, a national decree was passed making 11 municipalities in the north, in northern regions, Lombardy, Veneto, and Emilia-Romagna, not the whole regions, but just some municipalities, red zones. And this meant that entry and exit was prohibited and that movement was limited except for work and health-related reasons. So this slide shows how we took 4 different points in time, 4 different dates, and it shows how the virus spread from north to south, with a bit of an explosion in the northern industrialized areas and slower in the south. This next slide shows, it shows the daily number of new laboratory confirmed cases plotted against measures put in place by the country. And as you can see, again, it goes from the 24th of February through the 30th of April of this year. Italy took action immediately, declaring a state of emergency, declaring a national lockdown. Some interesting details about communication that this slide shows. On the 7th, this slide doesn't show this, but on the 7th of March, there was a news leak that about a decree that would extend restrictive measures to all of the Lombardy region, to all of Lombardy as a region, and to 14 provinces between Emilia-Romagna, Marche, Piedmont, and Veneto regions. And this caused a bit of a panic because that evening there was a massive exodus of people from the north going to their homes in the south. The next day, the decree passed, and on the 9th of March, the country declared national lockdown. Basically, Italy had to be very strict in enforcing the lockdown because things were moving very, very quickly. This next slide I wanted to show you because it shows how the perceptions changed in the country throughout this period where we were gathering more information. At the beginning, when the virus first arrived to Italy, interest groups, business associations, and politicians were launching hashtags and social media campaigns such as "We do not stop," "We're stronger than this virus," "Milan does not stop, we can fight the virus." They even were organizing COVID happy hours in Milan. But then perceptions changed very quickly when the epidemic spread, and some politicians who were saying these things got sick themselves. So as you can see in the center, it says, "Stop exaggerating about the virus." Then if you go to the top center, it says, "Now we're infected." And if you go then to the second below the center, it says, "They said it was only a flu." The left center says, "Everybody stop." And the top left says, "Now Italy is infected." So as you can see, information was going around very quickly in this period, and perceptions were changing very quickly. This is probably an Italy you've never seen. These are 3 important landmarks in cities that are very popular in Italy: Venice, Milan, and Rome. And you can see they were completely deserted, completely deserted. So among the most affected regions, this slide here has information from research carried out by Nancy Bimkin and her colleagues. And she found that among the most affected regions, the difference in mortalities or in outcomes were striking. And she looked at the north of Italy, Lombardy, Milan area, and Veneto. And those are the economic powerhouses of the country, and how both reacted differently to the escalating epidemics in their areas. And the approaches that they took might have played a role in how the virus evolved in those areas. So for example, in the Lombardy region, they used a patient-centered approach based on an extensive curative network. They initially were collecting data to understand the epidemiology and conduct modeling. They were trying to increase diagnostic capacity, promoting hospital-based assistance for cases. They were trying to introduce isolation and contact tracing. And they initially tested as per the national policy, limiting it only to symptomatic cases. And I want to just make an aside that Italy is a country that has very strong regional powers. It goes in, the national government passes decrees, but then regional governments put them into place. So this region, though, was following the national policy. On the other hand, Veneto region took a public health approach, and that was characterized by extensive testing, an effort to keep people out of hospitals. In-person contact with the health service really was minimized in this period. They put in place a broad and extensive contact tracing and isolation mechanism, and they set up cohort hospitals and convalescent hospitals for COVID only. And they tried to focus on keeping the health workers healthy. Not to say one was good, the other isn't. It's just to say that there were two different approaches taken. So the first part of Italy's experience has been documented for institutional memory, and it would take too long to go over all the aspects that were looked at. But among these, we looked at measures put in place, physical distancing, quarantine, how it was done, contact tracing, legislation, health system response, the surge in healthcare, taking care of healthcare workers, use of PPE, availability or not, long-term care facilities, and how implementation was steered, so the governance of how things were managed. Communicating COVID, which I spoke a bit about earlier, and collateral effects, which is the last point, but it's something that's having a big effect now because there's socioeconomic effects, long-term care centers, violence, etc. So this slide just briefly, very briefly, shows you some main lessons learned as of the 30th of April. And there are more now, but we're not carrying out the process anymore. So before, the importance of having a plan and acting quickly and making sure there's funding to do this and acting immediately. Ramping up testing capacity, laboratory and human, planning and responding to a surge in demand for clinical care, and reducing risks to health workers and their families. There has to be something, a plan has to be ready. Remember vulnerable settings and the populations they serve. Isolate infected people immediately. Protect family members, set up facilities for quarantine if patients cannot stay at home. Now I know the Veneto region has actual facilities. I think many parts of the countries have set up facilities for quarantine. Organize medical and mental well-being follow-up and social support for patients in isolation and families. There's been a big psychological impact of isolation on people. And communication, communicate clearly on criteria and practicalities of movement restrictions. Every day there was a press conference by the Civil Protection, and numbers were really just given to people every day, and sometimes it became a bit overwhelming. So think about how these numbers will be communicated. Is it necessary every day? Or if it is, how will that be carried out? And set up measures quickly with necessary legal and administrative frameworks. And consider different communications needs because these will change from the first month to as the epidemic tapers off. 4 points from the Italian experience.
We've got about 2 minutes left.
Okay, I'll try to go quickly through. 4 points from the Italian experience, which I think are valuable for SIDS. Beware of blind spots. This is something that was a big problem for Italy, and when they realized when it emerged, it was a bit late. It was now known that these facilities experienced excess mortality due to COVID as early as the first 2 weeks of February, but it was just everything was happening so quickly. While the epidemic was raging in the community and stressing hospitals, silent clusters were appearing in these communities, and mortality was quite high. In fact, 40.2 of deaths in the long-term facilities were associated with COVID. Pay attention to infections in hospitals because these became incubators of infection instead of protecting people, and infections among healthcare workers, and also burnout. And the needs for equipment and vulnerable populations. So what emerges really are inequities as a result of COVID, which are going to be dealt with now in the coming years. The next slide briefly just talks about a project that WHO is started in May on focusing on vulnerable populations in COVID, and it's going to be focusing on the elderly, both in long-term care facilities and at home, and those living in poverty. And the outputs are listed below. And okay, what was the role of partnerships during the COVID emergency? National partnerships were set up. The WHO office in Venice helped set up weekly webinars for Italian infectiologists, anesthesiologists, ICU personnel, and they were followed weekly. There was a chance to network, to exchange ideas, and multinational partnerships were set up. WHO also held weekly webinars for the Small Countries Initiative and the Regions for Health Networks targeting these countries on different topics. And these were helpful because they were a forum for expressing the most urgent needs. They provided a means of communication, and it helped to exchange ideas and gather more information. And what would be needed in the future? Opportunities to share experiences and know-how, networking and contacts to help out, but on concrete, like what do we do if we don't have enough PPE? We need to acquire ventilators or medications. As was said by Neville, there were shortages in many supplies. So how can this be planned for in the future? Joint trainings on technical aspects of how COVID was managed, and bilateral missions could help on technical aspects. I don't know how much traveling can be done, but some kind of bilateral, maybe virtual mechanisms could be set up to share knowledge. Sorry, I had to rush the last part. Thank you for your time, and I'm happy to be here.
Thank you, Lida. Thank you so much for that very detailed presentation. May I remind all participants that we will be sharing a copy of the presentations with all the registered attendees. And so we can actually now pass on to the next speaker. So we are going to have now Mr. Riyad Medeb. He is a seasoned economist and international development professional, has an extensive experience in situ, but also within the UN system. He is representing the UN United Nations Development Programme, and if I may, we share also a common passion, which is SIDS. Mr. Medeb, the floor is yours.
Thank you very much, Gabriella. Thank you for inviting me and giving me the opportunity to discuss with all of you about the lesson learned and in small island developing state during during this pandemic. Allow me to share my screen. I have 4 slides to present. Do you see the screen?
Yes, we do.
Thank you very much. So I try to see, okay. How can small island developing states, who all the presenters have already made a good presentation on the impact of the pandemic in small island developing states. For UNDP, how can SIDS build forward better? How can they build greener? How can they build bluer? So UNDP recovery support to small island developing states, a target with great mostly the opportunities of development. You know, it is very clear that the pandemic increased and highlighted the vulnerability of small island developing states. What are the main challenges that we have in small island developing states? That they require, you know, the energy self-sufficiency to develop sustainable economies. So most of them, and the majority of them, is importing its own energy. A lack of capacity to use the value of the ocean space. You may know that the whole small island developing states, they own 19.1% of the EEZ of the world, which is huge. They are large ocean states. And of course, there is one important challenge is the digital divide and the importance to use the current infrastructure in order to move further and to benefit from the fourth industrial revolution. So the vulnerability were exacerbated by COVID-19, especially due to the climate change. We all recall, all of us, because I see my colleagues from EUSIS here and Ambassador Rocha about the Placencia Ambitious Forum, where the Secretary General talked about, yes, we have the pandemic, but what the small island developing states are really vulnerable is due to the climate change. Reliance to import include to energy. The food was supply was completely disrupted. Dependence on tourism. Countries like Seychelles is 61% of their GDP. Aruba is 97.3% of the GDP. So this is what the seeds are looking for, and what Ambassador Rocha said very clear. They want concrete solutions, something very concrete, helping them to build back better. And the point that he mentioned, which is very important, taking into account the specificity of the seeds, which is developing a multidimensional vulnerability index, allowing the seeds to access to cheap money to be able to fund their recovery plan. So what are the main opportunities as we see for UNDP? Because we do not have only vulnerability, but we have really concrete opportunities. Increase global investment in global action, especially in energy transition. And we have an objective to reach 6 million additional population in small island developing states for renewable energy. Potential also on the blue economies, especially on sustainable fishery, on future tourism, because we need to have a new form of tourism in small island developing states, and tapping the capacity of transformative digitalization and digitization. So supporting all this information, the UNDP at the request of Secretary General was leading the socio-economic impact assessment under the guidance of the UN resident coordinator and all the resident UN country teams. And we were able until now finalizing 16 SIDS socio-economic impact assessment, which is leading now to the developing recovery plan for all the small island developing cities. This is very, very, very specific. The second element where we are working and give us a lot of information in terms of situation and potential is a digital micro-level impact assessment tool, which is a tool that we have already used in currently finalizing 7 cities, and we have more ongoing, which is informing government on resource distribution and planning to mitigate secondary impact on household and medium-sized enterprises. The third element, which I think, which is very, very important, and what happened, and Ambassador Rocha mentioned it several times, is the fact of the cities are in the middle of the fourth industrial revolution, and the potential for them is they are leading their development, and they are leading also in terms of moving to the digital transformation and the opportunities for having a transformative development. And for that, in some small island developing states, we have, through our accelerator lab in a network in the cities, we have 10 accelerator lab, 30 staff working on testing innovation within the cities. And we have one in Cabo Verde, because I'm talking here, which is quite interesting, on where they tested a platform on putting all the private sector, civil society together in order to have a dialogue and finding new opportunities for recovery, also on real information related to cities. But we've done also other things. For example, if you take in Barbados, without the tourism, the taximen were not able to transport any tourists. The fishermen were not able to sell their fish, and the farmers were not able to sell in the market their fruit and vegetables. Simple platform on e-commerce were able to connect farmers and fishermen to customers, selling them and getting the taximen to be able to transport directly from the fisherman or from the farmer directly to the client. It shows that there are solutions on digital which are happening, and you have to see the seeds are incubators of solutions that are going to be useful for the rest of the world. They are really innovating a lot, and we've seen quite a numbers of results this last month. For example, on digital and fishery in small island developing state, using geographic information system on coastal erosion, and also for having the information on the health and the impact of the spread on so many diseases. Finally, the main discussion of our webinar today is mostly on partnership and what kind of partnership, as UNDESA is leading on the partnership on the Samoa pathway. With UNDP, we were able to work with Rocha and have this connecting business initiatives, which is on supporting many cities in responding on recovery COVID-19, not only government, but private sector. And we've done it in Vanuatu as a very good example, and we're looking at the possibility of replicating in many other small island developing states. The second element, which is very important, and we mentioned that the supply chain is disrupted, is we are developing a business development impact investment platform with our partner FAO in order to put together and attract investment in agribusiness in small island developing states. This is very important. We need to make them completely independent, and this is what the states are leading now. The third one is on energy, and we have a very good partnership with ARENA, Sustainable Energy for All, and the GCF called the Climate Investment Platform in order to help the small island developing states for their energy transition. That's what I wanted to say in a very short, I know the time is short, Gabriella. So I have a video, I think you can put it online if you have enough time.
Thank you, Riyad, for that very nice video and a very insightful presentation. I would like to ask all panelists actually to comment perhaps on other panelists' presentations, or whether they have any comments that they would like to make. Ambassador Fraser?
Actually, actually, I have to say that this last one, all presentations, thank you very much. They were very, very interesting. But this last one, especially by Riyadh, I found extremely interesting. Especially, I actually took note about the percentage of the world's EEZ. Being a student of international law myself, I didn't realize, quite frankly, honestly, the high percentage of it, and how important this is, because you know, it really goes to show how these islands have so much territory, how these pandemics can affect our supply chains. And I mean, really, we think of small island states, we don't realize how many there are, how important they are, and how scattered around the world they are. Also, I have to say, the National Statistics Office presentation, why he excused himself in the beginning, so I don't understand why, because I thought it was very good. Really gave us a great picture about how the pandemic affects islands. And I mean, we see it obviously in Malta because we are an island ourselves. But really, when you see the numbers, you know, as a percentage of our populations and our size, it is very interesting, and we need to make sure that we derive the lessons learned from. Some of the countries have had some very excellent success stories in reality, because borders were shut straight away. Is this an important lesson to be learned? Would it have the same effect for larger states, for states which are landlocked, if they had to do the same? I think that your presentation, Alan, really brings a lot of other questions to mind, which I would like to explore. That was my comment. Thank you.
Thank you, Ambassador Fraser. Alan, would you like to comment on that?
Okay. Well, it wasn't an apology. It was just a disclaimer. I mean, the job was done by the international organizations who collected the data and produced the statistics. And definitely, the National Statistics Office cannot take the kudos for that. But they are our partners. We provide information to them on Malta, and even just information on Malta for us, it's a huge burden because we have small offices just like all other small island states. What I did in the research for this presentation, I only scratched the surface, really scratched the surfaces. There is a lot of data available on international organization websites, and from this, policymakers can start understanding the gaps and vulnerabilities. And then again, the international organizations are there to try and persuade national policymakers to fill in those gaps. So our job is to provide the data, the statistics, we explain the gaps, and then it is up to the policymakers, to you, to try to address them in the international community. So I'm glad that we actually set the scene, which was our intention and purpose for this webinar. Thank you.
Actually, thank you, Alan. That was exactly our intention when we roped in the National Statistics Office, in line as well with the Samoa Pathway and the Paris 21 agenda, in which we noticed that there is a lot of need for statistics and for SIDS to be more beefed up on statistical capacity. We have a question which I believe is aimed at Riyadh from UNDP. So, with regards to partnerships, how could other SIDS access the UNDP partnerships mentioned by the recent speaker to support these SIDS to engage as brokers of viable and responsible investments and partnerships for rebuilding and strengthening the resilience of SIDS? And I believe reference is being made to the Pacific SIDS.
Okay, thank you very much. And on partnership, you know, the UNDP is working completely with the UN system, and especially our resident coordinator. I know that my colleague, the resident coordinator for Samoa Multi-Country Office is connected, Simona Marinescu. Our role is to try to bring all together all the different actors supporting the SIDS in their development. But what is important for us is not only focusing on the vulnerability of the small island developing states, is focusing on the opportunities for a transformative development. And the SIDS by themselves, and even in New York, and Ambassador Rocha can talk, the first thing that they do is they talk about their leadership in their development. And they know exactly what they want. They know exactly where they want to be. But what they want from us and all the development actors is to partner and come together with concrete solutions. When he mentioned something, access to concessional funding, this is now that we need to have. The majority of the small island developing states are high income countries, middle income countries, but the reality of today, if you take into account only the GDP, those countries will not going to be able to access to concessional funding, which is one of the main recommendations of the political declaration of the midterm review of the Samoa pathway. This is the reality. This is the day-to-day reality. We don't talk about something only about the vulnerability. We talk about how can we help them? How can we help them to recover? And this is concrete. It has to be now. Debt restructuring, it has to be now. They have criteria that need to be taken into account. In the Pacific, we are present through 2 multi-country offices, one in Fiji, one in Samoa. UNDP has around 1,200 staff in small island developing states, which is the highest number of staff for us per capita. It's huge, but this is not enough. That's why we decided to accelerate and to increase our investment in 3 main areas where you can make a difference and respond to the decade of action and the Samoa pathway objectives. Climate action, blue economy, digital transformation, and a cross-cutting pillar, which is going to be the access to innovative finance. Thank you.
Thank you, Riyad. Ambassador Rocha, I believe you would like to intervene.
Yes, thank you very much. I will be very quick. First of all, as I said before, I'm delighted to be here, and I appreciated most of all the informations and the presentation made so far. Of course, we SEEDs, we know what we want in our different perspectives. We SEEDs, we have National Development Plan that builds on the major accelerators for our development. Let me take that most of them have to address our economic competitiveness and the diversification from the growth opportunities that we have, in one hand. Second, to address social inclusion and protection. And third, resilience to climate change and to extreme events. We know that, and we have plans for that, but right now, we are facing this emergency. In the case of Cape Verde, it can go until 2022. But then we have to build back better. And we cannot have silos, cannot have a silos approach. They fit to each other. It is important that we have a continuity and integration from the short and medium term to the long term. And finally, it is important to address the issue of sustainable financing for SEEDs. Of course, it's not about just to get access to concessional finance. We can raise the issue of how we can mobilize our internal resource. Cape Verde has 20% of GDP as internal resource mobilization, but we can add other solutions from debt solutions like illicit financing, and how to mobilize even the private sector and the financial system to come to add to our domestic resource. Eligibility criteria, it's about concessional finance, it's about other financial flows that can come from multilateral banks and international. Of course, we want to have private sector investment, but we have some obstacles in our course. It's about the risking the investment of the private sector in small markets like small islands. It's about overcoming the scale limitation and attractiveness for the private sectors. These are things that must, but unfortunately, we have some response, some positive response from some major stakeholders. UNDP is thinking about this multi-dimensional index, but unfortunately, the international community is still very fragmented and not coordinated in the way they approach the SEED's special case for sustainable development. Thank you.
Thank you, Ambassador Rocha. I will now give the floor to the Portuguese Deputy Permanent Representative, Mr. Nuno Matias, who will, yeah, exactly. Mr. Matias, the floor is yours. Mr. Matias?
Can you hear me?
Yes, we can hear you very well.
Okay. No, just a very brief comment, if I may, on my end. Thank you all, protocol observed. Much has already been said about the challenges posed by COVID-19 and the SIDS. And this has, of course, been aggravated by the geographical economics, environmental, social vulnerabilities. We all know that. But especially in the procurement of personal protective equipment, the PPE. So that because the competitive market conditions and the supply chains are overstretched. So I just wanted to take this quick advantage to maybe share with you an example of what can be done to address that specific issue. And the emergency response phase, as part of the Team Europe, Portugal supported a EU humanitarian air bridge to Santo Tomé and Príncipe. And we delivered various tons of emergency supplies and had medical staff on the ground. And so also laboratory material, medical equipment. So this was a partnership also, you know, to increase the resilience of the local health system. This was possible because of a broad coalition involving the Portuguese government, European Union, the Ministry of Health of Santo Tomé and Príncipe, and of course also the civil society, which is tasked with a lot of the implementation of this project. So what I wanted to highlight this, and to come back to our discussion, is this twofold approach. First, the spirit of the 2030 agenda, where we need coalitions which are broad as possible. And the second is that we also need tailored partnerships to address specific issues and specific contexts. Thank you very much.
Thank you, Mr. Matias. We will now give the floor to the UN resident, Ms. Simona Marinescu. We will give her the floor in a second. We are unable to find her at the moment, so we will pass on instead to Mr. Sai Navoti, who has raised his hand. Mr. Navoti, the floor is yours.
I was unable, I'm now able to speak. I'm sorry, Gabriella. Can you all hear me okay?
Yes, we can.
All right, I will be very, very short. And Sai, please excuse me for taking the floor. So first of all, I would like to acknowledge the quality of the presentations and of the dialogue that has taken place. So again, Excellencies, colleagues, a great opportunity to talk about this very dear topic to all of us, and to me in particular, as I cover some islands in the Pacific Ocean. I would like to bring a perspective from the region that I think applies to the entire world of the seeds. And UNDP and my colleague Riyad Medab, who are the strongest advocates for the seeds agenda, have created an interesting platform of knowledge where all those solutions that Riyad spoke about could be actually openly accessed. And I very much encourage whoever is interested to log in and use that as an opportunity to learn more about what could be done. The Pacific is, as you may know, almost virus-free. Our small island states in the Pacific closed the borders, discontinued all the economic and commercial corridors just to make sure that their populations are safe. That came at a huge price. That continues to grow as there is no strategy for reopening at this point in time to ensure that they remain virus-free. So we cannot move into reversing the socioeconomic impact because it's still growing and there are no immediate solutions to help those member states. The solutions, the lessons that we've learned in the process started with the first major one, which is the model of growth that small island states have, needs to be reconsidered. The socioeconomic dynamics need to be reconsidered at this point in time. As the world has changed, we are not going to go back to the time of prior to the crisis. And we need to understand that those small economies that remain so dependent on the rest of the world would not be able to protect themselves, to supply nationally, to respond to the national demand in the current circumstances. So that's a first lesson. The second lesson that came from this unfortunate global event that we are still experiencing is that small island states have never had very strong social protection systems, because social protection systems in the sense we know them would require a much larger size of the population to ensure that there is sustainability and that transfers from one generation to another are actually fiscally possible. The absence of social protection models put a huge strain on governments not
We've had a technical glitch over there. I do apologize.
I really
okay, sorry about that.
Okay. All right.
Sorry
okay,
about
so I
that.
don't know where you lost me, but I just wanted to mention the second lesson was the absence of social protection systems. Because of the size of the populations, SIDS have never had traditionally strong social protection systems. So governments had a problem in reversing the impact and ensuring that there is no new poverty and there is no new exclusion coming as a result of that. The third is the digital divide. SIDS do not have, at least in the Pacific, do not have access to services using technology, so that their physical isolation was almost impossible. So they still had to access public services to be able to go through the crisis. So that's a major investment that needs to be made. The last lesson is something that we talked about, and I would like to give assurance to Ambassador Rocha that this is a fight we fight together, which is access to financing. We need to move into this new world understanding that the special case of the SIDS requires a special consideration when it comes to access to financing, be it aid, be it concessional lending, and that's the time when we can do it. So some of the resident coordinators have started working on some criteria, and we would like to push until we can talk to the World Bank and to the OECD to ensure that we generate a space in which SIDS, being so vulnerable, could continue to have access to financing beyond the GDP per capita. That's a lesson that we've all learned and talked about. So whether we call it the multidimensional vulnerability index or whatever set of composite indices need to be used, we would like to make the push now, regardless of some of the contrary winds coming our way. We need to ensure that out of this crisis, understanding that model of growth, the socioeconomic dynamics of the SIDS are very complex, that we would create the possibility for those small governments to access financing and address their vulnerabilities. And I'll close by saying that the Secretary General mentioned in his statement at the high-level political forum that we are where we are because we have not had the SDGs at the heart of all of our policies and at the heart of all of our investments. That's very true. And returning to sustainability at this point in time is even harder than it was when the 2030 agenda was adopted. But if we do not build now on the lessons we've learned, and if we do not make now the changes that need to be made, I'm not sure we will have a second opportunity. And 2030 is quite close. Thank you so very much again. Thank you.
Thank you, Simone, and apologies for that mishap earlier on. Just one last comment from the chat, which is directed, I suppose, at Riyadh for the video. And basically, the question goes, rather than it is So the argument is that it is not small states that are not taking advantage of the blue economy, but in the case of some countries, it is a matter of capacity constraint and a matter of lack of legislation, such as, for example, defining the maritime boundaries, which is very complex. And for example, the attendee also mentions that in the Caribbean, our countries are facing the global pandemic and the hurricane season. And in fact, I believe there is a warning at the moment, and indeed our solidarity with all the SIDS in the Caribbean. And perhaps Ambassador Webson in his closing remarks can tell us more about that. So this has been an extremely interesting debate. We are now drawing to a close. So without further ado, I would like to ask His Excellency Walton Webson, Permanent Representative of Antigua and Barbuda to the UN, to take the floor for his closing remarks. Ambassador, the floor is yours.
Thank you. Thank you very much, Madam Moderator. Distinguished colleagues, USGs of DESA and OHR LLS, yourself, Madam Moderator, panelists. First, I want to thank you all for a rich and engaging morning. Unfortunately, I was not able to be at the beginning of the discussions, but from the question and answer section that I have heard, it seems that we have had a most engaging time. And I commend my colleagues from Malta and the others for organizing such a rich event. My fellow co-chair, Ambassador Fraser, and I saw the need for us to take advantage of working remotely and the need for us to find innovative and informative ways in galvanizing SIDS to action. The events of the past few months made it clear that the novel coronavirus, COVID-19, will forever change the globe for the impact on SIDS. The impact that we as SIDS would have felt from this health crisis and this pandemic can be devastating. What we have learned these past months so far is that as the world and the economies of the world become increasingly globalized, including extensive international travel and commerce, it is necessary to think about health in a global context. No longer can we just think of health within the boundaries of our islands or nations, but to think of it in a global context. As small as we are, and as remote as some of us are, the global health pandemic has left a devastating effect on us. We have just heard from the representative from the Pacific about islands closing down, despite the fact that there were no trace of the virus on those islands. But the impact of closing down, which is as a result of a health pandemic, is devastating. It is for these reasons why the SIDS partnership is important, and why we must continue to advocate for effective and durable partnerships. Partnerships such as the Small Island Center of Excellence located in Malta is critical and important in helping us to address problems of this kind. As co-chair, I wish to share with you some of the lessons that I felt I have learned and the need to promote partnerships for SIDS. COVID-19 disrupted much of our lives as we knew it. It made clear that the future for recovery will be difficult and uneven. However, in order for us to recover better as SIDS, we need partnerships that are based on trust. Trust in providing accurate information, and that is guided by science. Similar to SID's call for early warning systems for disaster risk reduction, we need a global health warning system that will ensure that even the smallest of countries, the smallest amongst the family of nations, can be prepared and will be prepared in the face of global pandemics such as we are experiencing. We also need to rethink the global stockpile of medicine and medical supplies and technology. SIDS are left to share for medical supplies, and in many cases are prevented from gaining medical equipment and access to medical supplies because of the structures and the breakdown we saw in the supply chain. We need partnerships that will reorient the global supply chain and that will ensure that even the smallest of countries have access to necessary medical needs during a global pandemic. Just yesterday, I was engaged in a meeting on vaccine. And as small island states, we need access to the vaccines that are being developed. We may not, some of us and most of us, may not be able to buy into the organized systems, but we need to have access. And that's why I agree with the Prime Minister of Singapore when he speaks of vaccine multilateralism rather than vaccine nationalism, because as small states, we know the value of multilateralism because it's the only opportunity we have for global interaction. It is clear that during this experience, we need partnerships that will improve technology that will allow small island states greater access to reliable broadband and internet services. This will enable us to obtain updated and accurate health information. It will allow us the ability to be better able to work from home, because working from home and education from home is fast going to become the new way. In the case of the future pandemics, and will also be able for us to digitize our economies and the way going forward of how we do business. Colleagues, and finally on lessons learned, as small island states, we can offer a lot to the world. Some of our islands have shown resilience in recovery. We have shown effective ways of managing contact tracing and effective ways of quarantining our societies and measuring progress. We have shown effective ways of sharing information, either regionally and sub-regionally. There are some lessons that if the globe turned its head to the small states, that we can learn from. The lessons here for us to export to the world and to the rest of the globe are many. And these are based on our experience, our own small island states experience. And these experiences can be valuable. One, effective communication. This is a key pillar of the crisis and governance during a crisis. Two, the adoption of a whole, the adoption of a whole society approach rather than breaking it up. Of course, as small island states, we don't have the luxury of going piece by piece or doing things piecemeal. We have to work to address the entire community that we live in, the entire island. This is something in terms of communication. Let us be clear that COVID-19 represents a significant threat to us as small states, but it has also presented us with opportunities for us to deal with sustainability and to look at lessons learned that we can share. How, sorry, from
Ambassador, if
yes?
I may, could you please perhaps draw your remarks to a conclusion? We were already running almost half an hour before.
Oh, surely.
After scheduled closing time.
Surely. How we do this is going to be based on the collaboration that we receive from the partnerships we build. For us in the Caribbean, as was mentioned, that we are already engaged in the hurricane season with warnings of approaching storms, some already churning our waters. We continue to depend on the building of partnerships. This ambassador and I will continue to engage our global community here as we reach out to share lessons, but more importantly, to learn the lessons that will allow us towards the achievement of the Samoa Pathway and the SDGs. Unless we work together, we won't achieve, as small island states, the SDGs. Thank you.
Thank you, Ambassador Webson, for those very interesting remarks. Perhaps I could ask our panelists, so Ambassador Rocha, Riyadh, Lida, I believe those are the panelists we have still with us. Could you perhaps give us a quick takeaway, what I call a tweet-style remark or a takeaway from today's debate? Ambassador?
Ambassador, you are muted.
Okay, thank you very much. As I said, for us, it is very important that we can engage our national responsibility in taking our business in our hands, but it's quite sure that either in a structural situation or in an emergency, we do need international partnership in order to support us. And this international partnership must be built in a coordinated way, in a very, let's say, rational way in how we can build this framework of partnership based on not only on solidarity, but also on, let's say, workable tools. And the way we have to get access to finance in a very concessional way, it's important. But it's not only the only thing. It's important also to bring, let's say, a seeds package or seeds compact of measures in an integrated way. Thank you.
Thank you. Thank you, Ambassador. Riyad?
I think one thing which is very important is to have a real strategy in all the small island developing states for reopening the country. This is one key element that I think for me it's important for being able to recover. So we need to develop a strategy for them to reopen the economy, to reopen to the world, and that's something very important, but also helping them to adopt new development model like they are looking for. They are looking for building the future, not building what they were before, building the future. So let's be all ambitious. Let's be all ambitious and focus on the opportunities that we have in the cities. And together with Rocha, together with UNDESA, together with UNRC system, private sector, civil society, all together we can come out together and support, and especially access to concessional finance. They need to fund their recovery plan. There is no recovery plan that can remain as a paper. Those plans need to be funded. So we need to come up all together, all the international community in supporting the cities. Thank you very much.
Thank you, Riyad. Lida?
Hi, yes. I was just thinking as I was listening to everybody, the importance of feeling the country's pulse. Listen to and document the real needs and join forces, as Riyad was just saying, work together, join forces to support each other as you already are, but also make your voices known in international forums. For example, the WHO has a small countries initiative. So this could be an initiative you could get involved in maybe in the future, maybe find out about attending a meeting. This year's meeting, unfortunately, was planned in Montenegro in July. It was canceled. I mean, the world has changed so quickly. So that's what I would say.
Thank you. Thank you, Lida. Thank you to all the panelists and all the attendees who have stuck it out even half an hour after scheduled closing time. Thank you to everyone. May we remind you that to perhaps pencil in and join us on the 10th of September for our next webinar, which will be entitled Small Island Developing States and Tourism, Propelling Resilience Forward. We'll just close off with some food for thought, perhaps. It is a quote, which I borrowed from Dr. Edward de Bono. You can analyze the past, but you need to design the future. Thank you.
Thank you. Thanks, everybody, for participating. Thank you, Patrick and Gabriella, for your moderation.
Thank you, Gabriella. Thank you, Ambassador. All of you.
Thank you very much.
Thank you and congratulations, my friends from Malta.
Thank you very much in your diversity of places. Thank you.
Thank you. Thanks, Aubrey. Thanks, everyone.
Thank you.
Bye.